Like they couldn't conceptualize that I had been training for that marathon for 10 years. And then once you're in a certain shape, you can maintain it with less sort of like stress on the body. Like there's a way to maintain fitness. Mind you, I was really trying to get into this program that the Army had. If you've run an Olympic qualifying time, you can basically run full time for the Army. You can take like a break of service, and you're still active duty, but you're an athlete. Okay, so that was kind of my goal. And anyway, they thought the running and the idea about PTSD being so off the wall, and the disorganized presentation for that patient I hadn't seen yet, putting those puzzle pieces together, somehow I am bipolar. And so they put me on Abilify again. And I basically conceded I wasn't going to fight it this time because I was like, there's a secondary gain in the military. Okay, if you get a diagnosis that will give you a medical retirement, you get paid the rest of your life, and you get medical benefits the rest of your life for you and your family.
So there really is a benefit to being able to obtain a diagnosis.
Oh yeah.
Is it all diagnoses or just limited diagnoses?
So they have a rating system. So the more severe it is, the more money you make.
Wow.
Yeah.
Perverse incentives.
Yeah. And so at this point, I'm like, I'll be able to work as a civilian, with my board certification and license, and I'll get a medical retirement.
So this reminds me of something and the challenges I faced in my work. I have seen combat veterans outside of the VA for PTSD treatment.
Yep.
And each person I met was not interested in being able to become what we would call like symptoms in remission. Yeah. Because they thought it was going to impact their benefits. So
it would impact their benefits.
Okay.
Yeah. You have to be medically ill to receive disability benefits.
So do you think there's a concern with this, with talking about psychological suffering in terms of illness, like a biological disease? Because we're putting it in the same camp.
Oh, yeah. It's a huge problem. Yeah. But even the biological disease, when you're talking about pain, I mean, my dad, as an orthopedic surgeon, stopped seeing backs. He wouldn't do surgery on backs. He said it's just...
The outcomes are horrible.
Outcomes are horrible. Yeah. But also there's just these secondary gains, to not... And even if it's subconscious, I'm not saying people do this consciously. But, if you can get those narcotics or you can get that disability check, why would you go off of that unless you really want to be healthy? Like if that's your ultimate goal.
Did you want out at this point? Because you conceded it to that bipolar diagnosis.
I was just going to let it see where it went.
Okay.
Because I thought it was absurd. I was like, you guys could call me a paranoid schizophrenic. I don't care at this point. Like clearly this relationship is broken down. If you're mocking me because I have an idea that I think can help a lot of people, and you're giving me 3-pagers, that running is a big part of my life, and you're mocking me for my running.
And you're not fitting the profile of being a good soldier for the most part, right?
I don't know. It depends on how you define a good soldier. I mean...
A good soldier complies, follows directives, and acts within the boundaries.
Yeah. Yes and no. A good soldier is physically fit and morally sound and can disobey unethical, illegal orders. But you have to have the mindset to know what those are.
But in reality, what happens when you do that?
They'll crush you. They may even send the FBI after you.